Hello, everyone. Good afternoon. My name is Maria. I'm from FRS Recruitment. I'm the commercial team manager for the Dublin office. You're all very welcome here today for this webinar, which is really topical at the moment in terms of getting back to work and getting back to work safely. So today I am joined by Paula Mumford, who is a senior team health and safety manager with SeaChange. SeaChange are a company based in Nason, County Kildare, in business since 2005. They're a family-run business, and basically they provide bespoke behavioural-based safety solutions for clients. So really a topical solution at the moment. At its core in safety, it's all about people and how they behave and the degree to which they're involved and engaged. And SeaChange responded very, very quickly to the COVID-19 pandemic, which is one of the reasons why we asked them along here today, because they're able to bring a lot of their knowledge and expertise that you'll be able to get from them today. John Gorman is a HR expert, and he's involved in HR and learning and development in his company Sunflower HR. Previously, he was HR director with Green Isle Foods, and he has multi-location experience in operational roles in HR and L&D across Ireland and the UK. At the moment, he's providing a consultancy service to his clients in relation to employee relations, problem solving, compliance, and all he's getting at the moment are queries from those clients in relation to how do we get back to work and how do we do so that we're taking care of our employees and taking care of our customers. So basically what we're going to do is we're going to have a chat about what's happening at the moment, what are people seeing on the ground, how we can get back to work safely, how we can get through the phases that are coming. Information on both SeaChange and Sunflower HR will be available to you at the end of this webinar, and we'll be able to give you links to their websites, or if you need contact details, you can contact them, or you can come through FRS Recruitment here. We can help you out, of course. So what I'm going to do is I'm going to hand over to Paula first. Paula, you can give a little introduction to yourself and maybe let us know what's going on in the ground at the moment in relation to getting companies back to work.
Absolutely. So hello, everybody. I have been working in health and safety for 16 years now, so quite some time. I began my career in construction and worked through machinery rental, access industry, and I've been with SeaChange now for the last 2.5 years, where I've come across a vast number of industries in such a short amount of time. It's been amazing. What I'm finding at the moment, especially with obviously COVID-19, is a lot of people are very overwhelmed. They're not sure exactly where to start. They're seeking advice, which unless you have a very strong kind of health and safety understanding and experience in your company, I would definitely recommend. What we're doing at the moment for our clients is carrying out risk assessments. We're providing them with policies and procedures in and around COVID-19 and the control measures. They're also getting some templates as well to help them with the likes of the return to work questionnaire, induction, sign off, etc. And providing a remote handover then as well. So that's a big thing that we're doing at the moment. We're also, there's a number of clients that they would have the experience to be able to, carry them out internally. And what we're doing is supporting them in relation to their response plans. So if they did have a suspected case or a confirmed case in their workplace, how would they manage that? As well as the lead worker representative, or what we're calling the COVID-19 safety champion. I think this sounds a little bit more positive of a role. So we're providing them guidance in and around that particular piece as well. So they're kind of the main components. And obviously providing then ongoing support to both existing clients, new clients and potential clients as well. They're ringing us looking for support and advice as well. So there's a lot of questions out there.
And hopefully we'll get through a few of them now today. John, over to you.
Yeah, thanks very much for the introduction. I think lots going on in the people space, to be brutally honest. Lots of questions and lots of challenges, I think, as people begin to start putting their plan together, or their people plan together to get back to work. The discussion has changed completely from what do we do with all of the extra people? How do we keep engaged with them in the middle of the crisis? And by the way, I'm still of the view we're in the middle of the crisis. We're not out of it yet. And lastly, or more recently, as people start to realize that it isn't as simple as June the 8th is around the corner and suddenly everyone's going to be back to work. And what does it mean for us? And ultimately helping the clients figure out when is it likely that they're going to be able to get back to work? Or even if they are able to partially open up on June the 8th or maybe June the 29th, that doesn't necessarily mean that all of your people will be able to get back to work. And in the meantime, what do you then do about that? Is the reaction from the employee reasonable? Is it unreasonable? Is what you're looking for as the employer reasonable or unreasonable? It's trying to get into that whole space and figure out how do you run your business or resource your business from the first chance you can actually get back open up in a reasonable way. That's most of the discussion. Outside of that, it's what do we do with people? So we're having issues, or I'm coming across or working with companies where the challenge is that managers don't have the skills to manage remotely. So what do you do to help people who are now a number of weeks in? The real issues around managing others are coming out. They may have been an opportunity for development previously, but it's significantly exposed at this point when they're not actually able to meet face to face or see face to face. And how do they manage, and helping them figure out how they manage others in the middle of that.
Okay.
They're kind of the main areas that are going on.
Okay. I'll come back to the issue in relation to the 8th of June shortly, but in relation to companies and businesses who can open from the 8th of June, Paula, what sort of, what do they have to have in place in terms of people coming and going, both employees and customers? Is there a general, it's a very broad question, but is there a general indication of what people need to have ready?
Yeah, so the return to work safely protocol that the government issue outlines the key steps that need to be taken. Now it's a meaty document to work through. So I suppose the summary would be to put in place a COVID-19 response plan. So that is where you basically collate all the control measures that you're putting in place to both manage and prevent, say, infection. So infection control measures from your customer point of view, your staff point of view. Also to put in place a plan if you were to have a suspected case of COVID-19 in your workplace. So what would you do if that was to happen? Also to put in place risk assessments in and around COVID-19, as well as reviewing your existing safety statement, your existing risk assessments. Look at your current policies and procedures, as well as your HR policies as well. So the likes of sick leave, okay, annual leave, that type of thing. So have you reviewed them in light of COVID-19? You also have, from a worker point of view, that you have to put in place a pre-return to work questionnaire, which is issued at least 3 days before they return to work. And then that's submitted back into you. There are key questions that are asked in that questionnaire, which are outlined in the Return to Work Safely Protocol. So they've made it quite clear, as well as preparing an induction piece. So everyone that returns to work, as well as those that maybe, if your business hasn't closed and maybe has been partially operational, include those employees in that as well. So that is running them through the controls that you're putting in place. So for example, you may have a business where customer-facing roles are in place. You may have put in screens at your till, okay, to isolate your employee from the customers. You may have put in staggered break times. You may have put in shifts. Okay, so there's a number of different controls that you may put in place. So you're bringing them to the employee's attention, as well as reminding them of the public health guidelines. So physical distancing, hand washing, respiratory etiquette. So coughing into your elbow. If you use a tissue, making sure that it goes into a bin and you wash your hands. When they get back to work then, it's very key to make sure that you have a representative. So this lead worker representative appointed. So this is the person or persons, depending on the number of employees in your business, shift patterns, the geography. It might be a very large site. There could be a number of departments, etc. So you have to appoint this person and make sure that they are in a position to offer you support in implementing the controls. So these are some of the key things that the Return to Work Safely Protocol have outlined in their document. And that's a very kind of simple summary of them. But they're the key things that are required before you even have anybody back.
Okay. Some of the documents that Paula mentioned there, she's very kindly sent us on links to those documents, which will be shared with you here as well. So if you need to download those documents, then you can do so. John, when people do start returning to work, okay, so Paula has mentioned having a person who's there as representative to help in terms of making sure that everything works well in relation to the new norm, if you like. And we discussed this earlier on in the week in relation to the culture of the company and making sure to keep a really good culture within the company and not allow it to turn into a finger pointing culture if something happens or if somebody does something that's incorrect. Would you agree on that?
Absolutely. But just before I speak about that, can I just go back and Paul has spoken very clearly about what needs to be done, and my experience is it's not what you do, it's how you do it. So you've got to, and I know this is a part of Paula's business is the culture, it's the environment that happens in. So this shouldn't be done in isolation. This should be a process of engagement with people across the business to get them involved and educate them early, get them involved in the decision making so they understand the risk. Do you understand why the control measures are in place? That they are able to implement that themselves, that the level of supervision, it becomes self-managing because people understand the risk, they are engaged in putting the control measures in place, and they allow that to happen. If you do that, you then get to avoid what you were asking about, a situation where we go from in hopefully a highly productive or a high performing environment where people are actually in work, focused on what they're doing and delivering for the organization, to now where they've had months out of work, working from home, and as they come back into the workplace, what you don't want is a situation, or you want to try and avoid as much as you can, a situation where people are concerned and due to genuine fear, genuine risk, genuine concern, that you don't end up in a situation where people are put in a situation where they are behaving in a way that they wouldn't have behaved in previously, unnecessarily in terms of managing the risk. So I think that engaging people early, having a discussion around what you're trying to control, what you're trying to do, and why you're trying to do it is pretty important in the middle of this. It's that the what you do is grand. It's the how you're actually going to do it is the piece that I would encourage people to think more about.
Yeah, absolutely. Okay.
Not just tick the box, which is a challenge for some organizations, that they'll just want to tick the box to say we have a COVID-19 officer or champion, or we have. That get you back to work, but it'll, in my view, put your culture at risk because people will be back at work concerned.
Okay. And I think, the big thing here is about making sure that your employees and your customers feel safe and secure and confident going back to work.
Really good point.
Just to touch on some of the things that you said there, Paula, in relation to maybe equipment that's needed and bits and pieces that companies are going to get in place. Is there some sort of a grant available for companies?
Yeah, so up until recently, there was a business continuity voucher that, certain businesses could avail of. And what they've done is that they've simply replaced it with what's called a restart grant. So this is available to commercial businesses with a turnover less than €5 million, up to 50 employees. And they occupy a premises that is essentially like subject to commercial rates. So the way it works is that they will review the rates paid in 2019, and you basically get a reimbursement of those rates. If the the amount that you paid in 2019 was less than 2,000, 2,000 is the minimum payment that you'll get. So you could actually get slightly higher than what you paid in 2019, up to a maximum of 10,000 euro. And what I would suggest is that you go to your local enterprise office website, or even just Google Restart Grant, and a website will come up with a list of all of the LEO, the local enterprise offices, and click on your relevant one, and it'll guide you through the process, the qualifying criteria, etc.
Okay.
Definitely worth looking into, yeah.
Absolutely. And I know we have a few small companies and sole traders listening to us today, so I'm sure that will be really, really important to them. I have a question there as well in relation to the small companies and the sole traders. Like, is there specific training that an owner manager needs to go through prior to opening? If you can both deal with that question for me.
Well, what I would say is that first and foremost, that the owner and the manager familiarize themselves as much as possible with what's been mandated in the Return to Work Safety Protocol. Mm-hmm. Have a look through that. Where they have, maybe they use an external occupational health and safety consultant, maybe they have the expertise themselves, to seek advice where required. So if they don't feel that they have, I suppose, the experience or the understanding to seek that advice. What I would say as well is that this protocol has been mandated for all businesses. So whether you're a one-man show or you have 100 employees, it's mandated for all businesses.
Okay.
So that's the key point to make sure. In relation to training, and we've had a question before in relation to this lead worker representative. Does it have to be certified training? Do I have to go to a company to get it? Again, it comes back to the level of health and safety understanding and experience within your company. Nothing says that you have to have certified training. It says that the employer needs to provide the necessary training. So if you feel that you have the scope and the ability within your company to do so, then there's nothing to say that you can't. However, where you run the risk is if you don't have that ability or capability within your company. And that's where I would definitely look to external providers for that information.
Okay.
Yeah, and I think what I would add to that is that there's quite a number of sources at this point for that. The SkillNet process has been exceptionally responsive. So if the area that you work in is covered by a SkillNet, I've seen a lot of the SkillNets now are providing that lead worker training or employee training to employees to get them ready to return to work. But it doesn't take away from the fact that at a local level, you're going to need job specific or employment specific, or you may need a training on the new policies and procedures following your risk assessments. And that needs to be signed off, very clearly signed off. You don't just provide it, make sure you have the records that demonstrate that you've provided that training and the person has signed for receiving it.
Okay.
We repeat very regularly, if it's not documented, it didn't happen. It didn't happen. So if it's not documented, it didn't happen. So yeah, absolutely, yeah.
There's a question there that's come in from Sandra. What if a person or a member of staff does not comply with the safety guidelines that have been put in place?
Let me handle that one.
Yeah.
That's a disciplinary breach.
Mm-hmm.
The core part of the return to work is that induction, and an essential part of that reinduction is an explanation to employees about what will happen if they don't, and you then need to make sure that you investigate that and respond appropriately to that, and not inappropriately, as in you don't need to fire everyone for minor breaches, but if it's a serious and repeated breach, that may actually cause an issue for their employment, and probably appropriately so if they're putting themselves, their colleagues, or perhaps your customers or clients at risk.
Okay. Just to continue on kind of the people side for a minute, John, can you give us an idea of the type of problems that your clients are coming up with now and what they're coming to you for advice on in relation to managing people going back. And also I wanted to bring up the fact that we mentioned at the start, not all businesses can open on the 8th.
Yeah.
You know, if you can still work from home, then the general consensus, I believe, is that you should work from home. However, there are a lot of people who are really struggling at this stage in relation to continuing to work from home, because they might be homeschooling and then doing the work and then trying to do other things, and they're really finding it difficult. Can those people go back or not? If you can elaborate on that, and then Paula can come in on the safety side as well, please, if you don't mind.
Yeah, well, Paula made a really good point earlier on that all the business owners need to be 100% clear on the return plan. They just have to figure out where their business fits in that and where it's appropriate. I genuinely, most of the conversations start with helping the companies or the employers figure out where do they fit, which phase are they likely to be able to return. Just because you decide you can go back to work or people are starting to go back, doesn't mean everyone is going back. So I think the first real discussion point is around when is it likely that you will get to open. When you get to the point of figuring out when you're likely to open, then you need to start realizing the risks and issues. And most of what I'm seeing at this point in time, on the assumption that people are aligned with the national plan, and that has been genuinely most of the discussions at the start, to say, no, you're not actually on June the 8th, or my understanding of your business is that it may not be June the 8th, or it's unlikely to be June the 8th. Maybe it's the 29th of June, or maybe it's August. So I think first off, there has to be a realization or an education for the employer, and I think that Paula's point around reading that in detail is pretty important at this point. There's no point in you putting the effort in to get back on June the 8th if that isn't when you're meant to be back. You can put it in, and maybe you'll actually get open again, but you may end up being shut back down again fairly quickly, either for a whole host of reasons, including the Health and Safety Authority, who always had the power to shut you, but most certainly at the moment, I expect that they'll exercise those powers pretty quickly from what we've seen or what I'm hearing. So I think the first thing is make sure you're aligned with the plan. Once you've got the plan in place, what I'm genuinely, one of the first issues that tends to come across is childcare. People who have issues, you've mentioned homeschooling and the difficulties at working from home. That's one level of issue. There's an even more significant issue that if you are actually due to open or can open, will the support facilities be in place for employees to enable them to go back to work? And if an employee, if you are open and that job is something that can be done or must be done in work or in the workplace rather than at home, and they are unable to come back, well, it may be, if you take the childcare point, it might be quite unreasonable of you to throw your toys out of the pram at that point on June the 8th, when in actual fact there's only a phased return, or on the 8th of June it's for essential healthcare workers only. And on the 29th of June, it moves to phased reopening of creches. So you're going to have to be reasonable and realistic about that piece of the jigsaw. And in terms of, there's a discussion piece around, well, whether the work can be done at home or must be done, or sorry, must be done in the office or the workplace, or must be done or can be done at home. And right out to August, if it can be done at home, well then, that's where it should be done.
Okay.
And it's very clear that piece in the phases, like on the roadmap, it repeats it every single phase. You know, where work can be carried out at home, it must continue to do so. I mean, even the return to work safety protocol, it states that, you know, office work should continue to be carried out at home where practicable, and non-essential work. And just what you were saying, Maria, just in relation to the, you know, health and safety side of things, that at this stage, I would imagine that most of them, if they have had employees working at home, that they've established a policy, you know, a working from home policy. If not, then you need to do so. And that should be developed in conjunction with the employees as well. because everybody's house is different. The environment that everybody's working in is going to be different. Here at SeaChange, what happened very quickly, we all have laptops anyway. We have our computer mouse and our keyboards and everything. And very quickly, screens were issued, monitor risers, that type of thing. So everybody then had what they needed. We have a working from home policy in place that it was communicated out to everybody and it was signed off as well. Obviously we're a company and a team, a lot of people, a lot of experience in health and safety. Yeah. So from the point of view of setting up our workstations, it was easy for us. But again, for companies where that might not be a capability or an ability within their employee base, there's lots of advice out there for that. But definitely a lot of this starts off with having a clear policy on how it's managed.
Okay. There's another question there which would land in your space there, Paula. There's a lot of new services around now, especially in the area of sanitizing and fogging for office space. What are your thoughts on this, and would you recommend this as a requirement prior to opening?
Okay, so if it's a business that's been closed down for a significant amount of time, you need to make sure that you do a clean. Okay, so I suppose the point is that if you have a clean and tidy workplace, then it's easy. That is easy to maintain. Then your cleaning routines that you have to implement. So it's very clear in the protocol that your existing cleaning schedules need to be reviewed with a view to increasing the frequency and the intensity to ensure that you get a high standard of both cleanliness and sanitization. Okay, so cleaning and disinfection are two different things. If you disinfect something, it shouldn't be done as a substitute for cleaning and vice versa. So if you haven't been there for a number of weeks, number of months, then the likelihood of there being any live virus is non-existent. It's not there. While they haven't stated an exact time, the HPSC say that between 48 and 72 hours is kind of the ballpark figure for the virus surviving on surfaces. I would look at your workspace. I would carry out cleaning, disinfection. If you really feel that after carrying out that exercise that there are gaps, then maybe look at the likes of fogging, etc. But what I'm finding is that they can be quite expensive. And I know a lot of companies, they don't have that money, I suppose, to spend on things like this. So it also has to be reasonably practicable. Have you done everything that is reasonably practicable in the eyes of the law? So you have to look at the cost. You have to look at the benefits. I've seen it advertised in that it gets to all those hard to reach places. And what I would say is that if it's hard to reach, then, again, if you think about the transmission, contaminated hands, respiratory droplets, how likely is that hard to reach place? How likely is it to get contaminated? And then how likely is it for somebody to actually get into those hard to reach places, to contaminate their hands, etc. So I would definitely start with the basics. And if they really feel that there are gaps where it might be of a benefit and that the cost doesn't outweigh those benefits, then absolutely work away.
Okay.
Yeah, one other point I would add from my experience, the downtime required for proper fogging to give you the level of sanitization you're talking about is pretty significant. And you're then into carrying out risk assessments for your people post carrying out the fogging. So as Paula says, you'd want to be very sure that it was an absolutely essential part. It doesn't replace cleaning or normal sanitization. And I think that may just be, if that's what people think it's going to do, from my experience, it absolutely isn't going to do that.
Okay. John, what happens if an employer needs to reshape or restructure or reorganize the team when they return? What sort of advice are you giving to people on that?
Do it. I don't mean to be trite about it, but the reality is that the world is going to be different. I think if I learned anything over probably 3.5 recessions in business, the simple reality is the sooner, if it's necessary, make it happen quickly. People understand that there's a very significant change going on, and to give people their credit, or your employees their credit, they've all responded appropriately so far. They've taken their leave, they're working from home, they're managing the risk, they're doing all of the things that you'd expect them to do as good employees. You're the employer. Plan what you need to do with your business. If it's a temporary arrangement, or you believe it's only a temporary change, that I'm going to say, approach it in that way. But if you believe your business requires reshaping on a permanent basis, go early. It's the best thing to do. It's not easy, it's not nice, but go early on it. You can't afford to be sitting around on no business at this point. There's too much going on. Get it on, make it happen. Engage with people, talk to them about it. They will understand. They have no choice. None of us have a choice but to understand what's going on.
And then, are you meeting or having queries from any companies who are thinking about when they go back to work and their staff are coming in and they lose the COVID-19 payment? Are they worried about being able to afford to pay wages?
Of course. Of course it is. The simple reality, the cash inside of the business is going to take quite a period of time to recover, whether we like it or not. So without the subsidies, most businesses are going, in the short term, are going to have a really significant issue. So that is an issue. Does that mean that they're going to end up laying off people if they actually need them? I think that's unlikely. I think that's more of a political decision, that a realization that's going to happen, that the subsidies that are in place are going to have to continue, not for 6 or 12 weeks. They're probably going to have to continue out further than that, as long as you can demonstrate that. Politically, I think that has actually gone quite well. Probably the biggest issue I'm hearing from that perspective is more the €350 payment. So employees who have managed well, or managed their lifestyle, or managed their outgoings on €350 a week, choosing not to come back to work at this point, because it isn't worth their while. As long as that €350 sits there, anyone who's on minimum wage, or even a significant chunk higher than that, it may not be economically worth their while to come back to work. So that probably is more of an issue for the clients that I'm speaking to, where they're saying that they've no incentive to come back to work.
And how can they deal with that?
Well, it's an issue for social welfare. You will have to inform social welfare when they come and ask the question, as they do. Have you work available? And by the time that wheel turns and you get to answer the question and their payment stops, that could be a couple of weeks.
Okay.
In a lot of businesses, that's a huge issue. And my advice is, I don't see you being able to resolve that with the employee if that is where they're at. You may have to look at other resourcing options on a temporary basis to actually fill that.
Okay, and FRS Recruitment can provide that workforce if you need it.
No, that's the reality of it. And for example, it may not just be the 350. If one of your team has a childcare problem and can't get back, you are going to have you still need that role, and you maybe don't have anyone else to redeploy into it. You may have to go out and temporarily fill that.
Okay, perfect. Paula, there's a question there from Catherine. We were talking about the training that will be done for going back to work. Is Zoom training and electronic acceptance allowed? Presuming it is.
Yeah. We have a number of clients that are planning on doing remote sessions with small groups of their employees. Some of them are doing them on a one-to-one basis before they even come back to work. So that they're familiar with the new controls, they're familiar with any new policies or procedures, they're familiar with any changes that may have been made to existing policies. So, for example, we touched upon disciplinary. Somebody doesn't comply with safety guidelines. So you're bringing it to their attention that the disciplinary procedure, or the policy, should I say, has been updated to include non-compliance with COVID-19 specific safety measures. and that non-compliance can and will result in disciplinary action. So absolutely, Zoom training, electronic acceptance is fine.
Okay.
Definitely.
Okay.
Yeah.
We're on this now just over half an hour. So I'm going to ask both of you from your own perspectives, for companies that are preparing to get back to work in a safe manner, again, it's very broad, but what's the one biggest tip or piece of advice that you can give to business owners and managers? Paula,
on you, John.
Well, I, as I said earlier on, it's not the what, it's the how you do it. So I would, in a business with 4 or 5 people, I would get all 4 or 5 of them involved in the planning. With a business with 150 people, I would probably take 10% of the workforce and ask them to get involved on a project basis in helping us plan what we do. And if you have a business with 250 people plus maybe 10 people that represent each of the different functions, just make sure all of the functions and all of the levels are involved in it, so that they're able to champion that across your business, and they feel engaged and they feel involved and they understand why you're doing what you're doing. The psychological side of what's going on at this point as we go back to work, to my mind, is going to that fear piece, and to try and re-energize people as they move from effectively a socially isolated situation to physically back being in the same company that everybody with their colleagues. People are concerned around that, and I think the more we engage with them, the more we involve them in what we do, the easier or the more likely it is that that's going to be successful. Okay. It will also help, and I think part of we haven't touched on it at all, but if someone becomes ill back in the workplace, that is going to have a fairly significant impact on the people who are around them. And if people haven't done or are not doing what they're meant to be doing properly, that is actually going to leave a mark in your organization for quite a significant period of time. So the more consultation, the more engagement, the looking on the issues or the matters that arise out of the risk assessments as an opportunity to, I'm going to say, proactively get ahead of these kind of issues, which will leave long-term marks, I think is critical. That's the one thing. Get people involved, engaged in it.
Okay.
And the protocol is very clear as well, about going through this process in conjunction with your employees. It references a couple of times through the return to work safety protocol. So there's no getting away from that piece. It's so important for buy-in, and I suppose to follow on from what John is saying, that the measures that you're putting in place, yes, they need to be effective, they need to be practical, they need to be workable, and they need to be sustainable. So you have to think 12 to 18 months down the road, can we keep this up? If you have something that is completely unreasonable, it doesn't work, or is not workable, it's not practical, it goes against everything that the employees are trying to do, they're not going to do it.
Yeah.
So by involving them, you're going to ensure, or at least, you're going to ensure that they're as practical as possible. And I know of a hospitality group, and they set up steering groups. Now, obviously, a hotel is a large premises, a group, obviously, lots of hotels. And they set up steering groups of employees to physically go through step by step within each department. And they've developed a really good set of protocols for each of their departments that are very practical. The people that were involved had experience of different hotels, life in that department before they, were ever promoted. So lots of understanding around it. And they have a really good set of protocols. Whereas if they'd done that at a desk, remotely without consulting with anybody, they'd be reviewing them on an ongoing basis, from then on.
Okay. I think I don't want to go without answering questions that are coming up, and Catherine has asked, if we require someone that is working remotely to return to the office on a staggered return due to poor internet, that has already been that they've already tried to resolve, can they refuse to return to an empty office?
Good question.
I think it's back to what John was saying earlier about, why are they refusing to return? Is it childcare?
It seems to be,
possibly.
Yeah.
Sometimes, one of the things that I would always advise around, you can jump straight into disciplinary if you want, and I think consultation and talking to people is, or you can get into frustration of contract. You need to understand why the person doesn't want to come back to work. And it could be a lifestyle issue. It could be they're having a ball at home. Or it could actually be a childcare issue, or, as I came across during the week, an absolute fear of getting on public transport. One person who just literally is so concerned, and it's a genuine, you can feel it from them. Where another is just saying, well, the bus service is just unreliable right now, and that actually isn't correct. The buses are actually running as
they are. Yes, yeah.
You just don't have as many seats. That's the difference. So, and that was their understanding. And when you explained that to them, they went, okay, well, I'll at least try. So I will try and get on the bus on June the 8th to go back to work. And if there's a problem, let's deal with that when and if there's a problem, rather than assuming that there's going to be a problem. So I do think it is around a discussion. Clearly they're making, or have made reasonable efforts, and you've made reasonable efforts to allow them to be able to work from home. If they're unable to work from home, well, then you have the possibility, in my view, of laying them off because they're unable to fulfill their contract. You've made your best efforts, they've made their best efforts. So in those circumstances, you may, having done your investigation or looked into it, you may be able to lay that person off legitimately. Okay. We may not have laid them off at this point.
Okay. Thomas Cooney has asked, what are the rules regarding time spent in the office? But I think that's probably individual up to each company. Would that be right?
Yeah, I'm assuming, and correct me if I'm wrong, I know that there was, this came up when TDs in the Dáil, there was this rule of no more than 2 hours spent sitting in the Dáil. And then the courts then got involved and they were like, what about us? And it's just kind of, and it's just kind of snowballed from there. At the moment, what we're saying to clients anyway, they can absolutely work in their offices or their work environment once they ensure that there is physical distancing, that they have a clean and tidy workplace, that they implement their cleaning and disinfection routines, that they don't share, they reduce the amount of shared equipment, that they identify their high touch points and that there's an awareness around that they ensure that the area is ventilated, so opening the windows where possible if they have them, doors, etc., restricting the number of visitors, contractors that can come into that area. So there's a number of things that can be done. Maybe they might be directly opposite each other. Some desks are set up in a configuration where there might be 4 people. And what they've done is they've tried to move 2 of those away, or they've put up screens as a starting point, so that there's lots of different measures. But that 2 hours, 2 hour rule, it hasn't been followed through anyway.
Yeah, okay. There was some follow-up last week basically saying that wasn't correct. That didn't come as clear advice. It's not to say that it isn't appropriate, but it definitely wasn't advice that was coming out. So the 2 hour thing is debunked, would be my view. You've got to risk assess it, and you've got to manage and reduce the risk for people, full stop. But there is no one saying that after 15 minutes or 2 hours or whatever it is that you can't be in the same space. Yeah.
Okay, right. So we've come to basically the end of our webinar. I just wanted to say, as I said at the very start, that we'll be sending out details in relation to the webinar, a link so people can see it again. Also, just to let you know that the FRS COVID Compliance Office also do training, and they're involved with the SkillNet, and we'll be sending out information in relation to that, in relation to COVID compliance training, if anybody's interested in that. keep following FRS, please, on LinkedIn, on Facebook and Instagram, because all of our updates come up there regularly in relation to what's happening. For now, I just want to say a huge thanks to both Paula and John for your wealth of knowledge today. It's been very interesting. I hope everybody got something out of it today. And best of luck to all businesses who are going to be reopening over the next few months. Okay.
Yeah. Thank you, Maria.
Yeah,
Thank you both.
enjoyed it. Thank you.
Go and enjoy the beautiful weather now. Take care, everyone. Take care.
Thank you.
Bye-bye.
Bye.